Being pregnant can be an amazing time for soon-to-be mothers, but oftentimes it can be painful as well because many suffer from back pain. But there are some exercises that can help. Here to show us what to do is Dr. Hooman Melamed from the Spine Pro and model Heather Frudakis. Thanks so much for joining us, the both of you. And thanks so much, Heather.
Yeah.
You were in your third trimester. Congratulations with your first child.
Yes.
But experiencing back pain, as we all do when we're about to have a baby. Doctor, thanks so much for joining us. First of all, what are the causes of back pain through all the trimesters and even post-delivery?
Well, actually, even going back, 80% of people at some point in their life, they get back pain. And, you know, in pregnant women, it becomes a little bit more common because your center of gravity goes forward.
Right.
So it's like having a gallon of milk. If you hold a gallon here, it's much easier than holding the gallon up here in the front. So in the pregnancy, as it grows, it's like the gallon of milk becomes more and more forward, and that puts more strain on your back. And not to mention the hormonal changes, it causes a lot of relaxation of the ligaments, the tendons. You're more prone to injury. So as the pregnancy goes, you become more and more prone to injury. So the steps would be to prevent and strengthen your back from the injuries from happening. And actually, we'll go even a step back. Before you get pregnant, you should start getting in shape.
And Heather, let's show us some first trimester exercises. And did you try doing this when you're in your first trimester?
Yeah. Yep.
So one of the exercises to do is like you imagine like you're a wall. We don't have a wall here where we can demonstrate. So standing in the wall basically, Heather will go down. Now we can't go all the way because there's no wall. I'm basically pretending my hand is a wall here. You want to make sure your toes are always in the front of your knees basically when you go down. And as you're going down, you want to hold that position, and then you want to squeeze your glutes, your butt muscles together, and at the same time you want to bring your belly button, you want to pretend like it's coming back as you're getting it squeezed. And that kind of starts engaging your core muscles.
And these are exercises you can do at home. You don't have to go to a gym.
No, absolutely not. These are like part of the Pilates. You know, you can definitely start incorporating these exercises. This is one of the exercises you can do in first trimester, second or third, or even, as I said before, or after pregnancy.
Okay, and in your second trimester, you're starting to really feel it. You're starting to really show. What are some exercises for that time?
One of the things you can do is the lunges is another great exercises to do. So basically, with the lunges, we want to go, Heather, you want to go forward basically. Yep. And again, the same thing. You always want to make sure your toes are in front of your knees. And another way to do it at the same time, you can have like, imagine you have 5 pounds of weight on each arm. So as Heather goes down, basically the weights go up like that.
And that's really hard because you have so much weight. It's hard to keep balance without falling over, right?
Well, this is a great way of building proprioception, like neuromuscular feedback, and that's another way to engage the core also. And you want to have the feet shoulder width apart. Basically.
And what about your third trimester, which is what you're in right now, Heather?
Another one is the back extension. We can have Heather go ahead, lay down. You can have resistant bands basically. You can put this on, it's a little bit easier, and then you can have basically start engaging the back muscles. You imagine like you have a pencil back here, and you want basically like you want to squeeze the pencil between your shoulder blades. One is the rows like that, or you can expand it back out like that.
So basically just strengthening all of your back muscles.
It's going to be very critical. I mean, there's like incline push-ups you can do, other lunges, like a little bit of squats. I mean, Pilates is a fantastic exercise to do.
And Heather, have you noticed changes in your back pain?
Yes.
Much better?
Yeah. Yes, definitely.
Okay.
Doing exercises helps.
And a point in her life where she's looking forward to post-delivery, what are some exercises you can do?
Post-delivery, I think, you know, basically continuing on with the exercise is definitely getting, as soon as you can, get back to Pilates. And, you know, just common sense stuff. For example, a lot of times, like women, like grabbing the child, they want to move over.
Right.
Like, you want to basically always, you don't want to bend from your back. You want to bend from your knees. And it's like, I've seen like a lot of like parents reach over behind in the car seats, you know, just get out of the car. It's okay, go out, you know, come, it takes like 30 seconds, you know, it's okay. Like you want to avoid like twisting movements, and you always want to bend on your knees, not on your back, basically. And just imagine like how you are carrying the baby too. I mean, don't try to hold the baby. If you have to like reach in the bed, you know, try to bend down and grab the baby like that, bring it to yourself, rather than bending over and doing that.
And about how long can you continue to do these exercises, right up until the very end?
I mean, most women, sure they can, but I would always say check with your OBGYN, because there's some women, because of some complications that happen during pregnancy, maybe on bed rest, obviously you can't do everything. So you always got to be with your OBGYN doctor to make sure. But these exercises, if you can do it, by all means, you should do it all.
All right, great advice for even non-pregnant women too.
Absolutely.
To be ready for that
There's
pregnancy.
actually yoga for pregnant women too, so people can look into that.
Fantastic, Dr. Melamed. And Heather, thanks so much for joining us, and good luck with your baby. You're going to do great. Your back is going to feel great. I can tell already. Thanks so much.
Thank you.